Well, that would mean then, to get back to my original question, that somebody might not have diabetes, might not have obesity, and might exercise a lot, but because they're depressed, might they not have good heart rate variability and therefore be susceptible to heart disease, even though they didn't have those other risk factors?
Well, it is true that somebody who's depressed, who already has coronary disease, may have a much higher risk of dying after a heart attack because of this loss of heart rate variability. What's not clear is how long you have to have depression in order to develop heart disease in spite of a number of other risk factors. How many other risk factors have to be there for depression to be the sort of catalyst for developing heart disease?
So in other words, you're not certain that the research shows that the depression will cause in a normal heart, it'll create that problem. You think it's only in the heart that's already damaged?
I think so.
Okay. Well, what about things like blood clotting and the ability of platelets to clot? Some people seem to think that depression makes it more likely that the blood will clot, and therefore more likely to have an occlusion.
Good. Well, that's the other important biological pathway by which depression can accelerate the development of heart disease, so that the hardening of the arteries in the coronary arteries involves the development of blood clots and plaques around the parts of the coronary artery that are hardening. And depression has been shown both in animals and in people to increase the stickiness of platelets, which are the cells that form a lot of the clot. And treatment for depression, either through medications or psychotherapy or exercise, the recovery from depression returns those platelets to their proper level of stickiness. So it's very possible that depression contributes to the acceleration or progression of heart disease by making platelets more sticky and making the plaques more likely to throw clots.
Well, now, would that work because the treatment of depression makes the depression go away, or will it work because some of the antidepressants seem to have that quality that affect the platelets?
That's a good question for which we don't have the definitive studies yet. Most people think it works both ways.
Okay. And what about how else would you describe the mechanism that the treatment works for depression? In other words, when we treat depression, what's happening that makes the risk for heart disease go down?
Well, I think one thing that happens is behaviors change. People learn to be able to eat better, sleep better, exercise better. I think biology changes so that we can regain heart rate variability, better control of our inflammatory system so that we have less inflammation going on in the coronary arteries. Depression promotes chronic inflammation, and that's not good. I think there's some mysterious dimensions that we don't understand, such as how hope translates into better health, and people who get treatment or recover from depression regain their hope and regain meaning for life. But it certainly happens on many levels. It's not enough to just take a medicine or just do exercise or just do psychotherapy.
Okay, well, mentioning hope is kind of interesting. And of course, the opposite of hope might be despair. I remember reading an article not too long ago in the New England Journal called The Broken Heart Syndrome. It had to do with like sudden onset of cardiac symptoms, and earlier you mentioned sudden death. Do you think there's anything to this, that sudden death might be related to some kind of a bad news situation, somebody getting bad news, somebody breaking up with them, or having a loss, someone dying, could cause some kind of a broken heart syndrome that could lead to some serious cardiac problems?
No question about it. And these are the most dramatic examples of the influence that the central nervous system has on the cardiovascular system. The article that you're referring to in the New England Journal, I think, documented a substantial number of cases at Mass General Hospital in which there was clear evidence of toxicity to the muscle of the heart attributed to excessive levels of adrenaline circulating in the body. And the presumed mechanism is that when people get extremely excited, challenged, or threatened, their adrenal glands can secrete enormously high levels of adrenaline to the point of the adrenaline becoming toxic to the muscle. And so it looks like a heart attack in terms of symptoms, but the muscle doesn't die. It becomes stunned, as it were, and behaves like a heart in heart failure for a matter of several days. But hospitalization usually calms down the person and relieves the sense of threat, and within a week or two, the heart is back to normal, and the person is functioning, and there's no evidence of a heart attack. So it's a bit of a mystery that is only just now being well explained on a mechanism level, and it's just the most dramatic example of how shock or surprise or elation in people with vulnerable hearts can lead to sudden death or a heart attack or an arrhythmia.
This kind of leads us to a dilemma, doesn't it? In other words, how do families and doctors approach the situation where someone has heart disease and they have to be given some bad news?
Yes, very tough, and it makes the consequences of doing it badly sometimes quite dire. But it's important to remember.
What's the right way to do it?
Well, I think that's going to vary a lot from person to person. I think it's important to remember that what's most striking is how resilient the heart is, and that most of the time we all go through enormous shocks without suffering this broken heart syndrome or dying or having arrhythmias. And I think the right way to do it will depend on knowing what gives a person a sense of safety, providing them that sense of safety before laying on the bad news. And that may be having the right people around, it may be having the right medication around, it may be breaking the news in slowly, may be doing it in various stages in order to monitor how well this person is coping.